At this stand, Swiss nurse Katrin Arnold is presenting the work that's being done in crisis areas by Doctors Without Borders. It'll soon be her turn as she'll fly to Liberia to treat Ebola patients. The risks that she'll face are new to her, but they don't seem to lessen her determination.
I
was deciding between an Ebola-stricken area and war zones like Syria and Iraq. I came to think that an Ebola epidemic is more predictable, as it depends on personal responsibility. We have very strict protocols, and so I'm responsible for my own safety.
On the other hand, Sabine Hediger, also a nurse, has first-hand experience of the situation on the ground and of the working conditions in West Africa. She recently came back from Sierra Leone, where she worked in an Ebola treatment centre. She has a vivid memory of the fear that struck her before her first contact with an Ebola patient in the so-called high-risk zone.
It's a strange feeling. It took me some time to overcome. Each of us working there fortunately shared the same emotion. We really had to tell ourselves, let's go for it. This is why we came here. We wanted this. We had to reassure each other in order to get in there.
Photos from the treatment centre. The red fence marked out the critical zone. This area is accessed by the nursing staff only when strictly necessary and only in protective suits. All objects coming from this section are then burnt. This means up to 200 protective suits a day. Hediger remembers how they often had to improvise.
In the beginning, we didn't have protective suits, so we collected all the tarpaulins we could find in the hospital, and one evening we made our own suits that we'd use on ourselves, at least to get things going.
For the epidemiologist Christian Altau, the statistics of the epidemic prove that even basic preventative measures, such as aprons, masks and gloves, are effective.
The transmission of the disease is actually not so simple. You need to come into direct contact with bodily fluids of an infected patient. So one sick person will not spread the disease to that many people.
Altau has carefully followed the development of the virus's reproduction rate since the outbreak of the epidemic.
We were thus able to show that this outbreak of Ebola in West Africa is behaving in a very similar pattern to previous outbreaks in West Africa. The number lies roughly between 1.5 and 2.5. This is in fact relatively low. There are other highly infectious diseases such as measles, where the reproduction number might get to 15 in an unvaccinated population. Measles transmission spreads through the air. It's therefore much more likely to spread.
But then why have 300 health workers been infected with Ebola? Inadequate or non-existent protective clothing is only one reason. Contagion occurs, as is often the case, when there's a breach in the safety protocols. This happens especially when emotions are involved. Sabine Hediger experienced this herself when an Ebola patient died giving birth to her child.
Das Baby hat überlebt. Und dann hat man nicht gewusst, was man mit dem Baby machen soll.
The baby survived, and we didn't know what to do with him. He tested negative for Ebola and was taken away from the high-risk zone. The nurses there were very happy to take care of the baby, spoiling and pampering him, until he started showing the symptoms. To everybody's disbelief, he then tested positive for Ebola. At the end of the day, it's about people and empathy towards others. And to say that the baby had to stay in the contamination zone is a very hard call to make.
Those errors of compassion are the ones that Ebola doesn't forgive. Nevertheless, with time, Sabine Hediger lost the initial fear of dealing with Ebola-infected patients.
You come to realize that if you follow procedures and you're wearing protection, nothing can happen to you. You're probably even more protected than when you hug someone in a private encounter. Once you overcome these fears and have this awareness, you're prone to a feeling of pride and tell others of it. There's a pride in realizing that we can do our work without getting infected.
The knowledge that going on an aid mission is not a suicide mission also helped Katrin Arnold stand by her decision. She has confidence in the fact that protecting herself against Ebola will be in her own hands.